Mohammed begins our broadcast with these latest containment measures.
Kenya's almost 2-month journey of COVID-19 has witnessed highs and lows by numbers of infections, but due to targeted mass testing in the last few days, the numbers have been rising alarmingly. With a total of 68 cases in Nairobi's Eastleigh estate and tens more in Mombasa's Old Town, the two regional epicenters have attracted a strict response.
There shall be cessation of movement in and out of Eastleigh area of Nairobi with effect from today, the 6th of May 2020 at 7 p.m. for the next 15 days. There shall be cessation of movement in the area known as Old Town in Mombasa with effect from today, the 6th of May at 7 p.m. for the next 15 days.
In the Public Order Act released this evening, the Ministry of Interior orders for restriction of movement into and out of those designated areas, except as shall be permitted in writing by a county police commander. In Eastleigh, the affected zones stretching from General Waruinge Road at Pumwani Hospital roundabout, 1st, 2nd and 3rd Avenues and 17th, 18th and 19th Streets, and roadblocks will be mounted at Eastleigh North, Eastleigh South and Moi Airbase. It has defined the boundaries of Mombasa's Old Town, whose boundaries will be marked at Makadara to the north and Fort Jesus to the south. The news of cessation of movement have not caught residents of Eastleigh by surprise.
Tunataka kupata afueni kutoka kwa serikali kwa sababu wametufungia Eastleigh. Hatuyuko tayari kulipa manyumba na maduka na all form of rent kwa sababu hatuna uwezo, kwa sababu kazi yetu imeharibika. We are not doing anything.
People here in Eastleigh have been tested for 3 to 4 days. And then within 3 and 4 days, the government has announced a cessation of movement abruptly without giving enough notice. So it's so unfair for residents and business people here in Eastleigh and people who depend on Eastleigh for their daily living.
Corona ambayo iko Eastleigh, mbona hatuoni contact tracing?
Wachani kutuonea, mtufungulie biashara tufanye kazi. Corona, hakuna kitu unaitwa corona serikali.
By blocking the movement into and out of two particular estates within Nairobi and Mombasa counties, the Ministry of Health now says that this will be the best movement to curb the further spread of COVID-19 in those areas it considers hotspots.
We have identified some epicenters where the numbers have continued to grow. These are especially Eastleigh in Nairobi and Old Town Mombasa. The situation in those areas has now become of serious concern.
But there is yet another challenge for the authorities, that of patients now dying from home. The 2 deaths announced Wednesday are in Mombasa County and both died in their homes.
In the past 1 or 2 weeks, we have realized increased cases of deaths at the community level, or patients dying upon reaching the accident and emergency unit, especially in Mombasa. And therefore, they are likely to be shedding very high levels of the COVID-19 virus, therefore making them extremely infectious.
While mass testing continues in areas where containment has been imposed, the government now says that it will foot all bills of those who will be taken into isolation facilities for treatment. Leila Mohammed, NTV.